Hello, and welcome back to another episode of Straight Up with Steph. Today, we are talking about biological dentistry. If you don't know what that is, it's basically a philosophy for providing treatment that looks at the root cause of why people are maybe getting cavities or why they're inflamed. Not just putting Band-Aid solutions on it like we tend to do, but really looking at why these things are happening. I'm interviewing a biological hygienist. Her name is Barbara. I've followed her on social media for a while, and I'm constantly seeing posts that she's posting about like fluoride toxicity or mercury issues or using microscopes or using ozone therapy. And honestly, I could learn a lot about all of those things. So I wanted to bring her on today specifically to talk about fluoride toxicity. And this is a hot topic right now, and it's like a political issue, which is weird, but people tend to either be one or the other, right? They're pro-fluoride or anti-fluoride. In whatever camp you consider yourself to be, it's really important to look at the science from all aspects and not just look at things that support you being pro-fluoride or being anti-fluoride. It's really good to look at the whole picture. And it's confusing because there's studies out there that say fluoride is perfectly safe, it's fine, it prevents cavities. And then we have some studies that show that, yes, maybe there is some cavity protection, but look at all of these other things that fluoride toxicity can cause. And for me, myself, I didn't learn until recently that the fluoride in our water is not the same naturally occurring fluoride that's just found in nature. It's actually a byproduct of like fertilizers. Barbara fills us in on that a little bit later, but it's kind of crazy, right? I didn't know that. Barbara and I also talked about just the importance of being open and being willing to learn things that maybe go against what you were taught in school. I remember when I was in hygiene school, we were taught not to provide any kind of dental treatment on pregnant women. That's not the case now. We all know how important it is for pregnant women to really maintain their oral health. So that's just one example of something that they don't teach anymore. And maybe you've thought this way about fluoride. Maybe you have that experience with fluoride, maybe in school. Maybe you were taught that fluoride is great and it prevents cavities, and maybe you still feel that way and that's fine, but maybe you're questioning it. I find myself questioning it sometimes, and that's okay. It's good to learn things and keep evolving. Science keeps evolving, and it's okay to change your mind if you want to, based on the science. Barbara fills us in today on what the science is saying about fluoride, how it affects our brains and our bones and other organ systems in our bodies, and also some alternatives that have been shown to be effective for preventing cavities. We also talk about how she uses a microscope in her practice and what ozone therapy is. I've heard ozone therapy here and there, and I'm like, I don't actually know what that is. So she tells us all about that today. We have a lot of people in dentistry that are frustrated with the current climate of things that are going on, specifically hygienists. They're feeling undervalued, they're burnt out, they just feel like these robots that are expected to just scrape teeth all day. And for some, that's fine, but for a lot of people, they're just really looking for something more. And maybe practicing in this biological, holistic way could be just enough to kind of snap people out of their funk and make them passionate about practicing hygiene again. This was just a really fun conversation about a way to practice that is different than traditional practice, but I'm hoping that it will get more and more steam because I'm all about looking for the root causes of why we're experiencing certain symptoms instead of just putting Band-Aids on it. I hope you enjoy today's conversation with Barbara. Hey, it's Steph, and welcome to the Straight Up With Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Barbara. Thank you so much for joining today. How are you?
I am very good. It's my pleasure to be here. Thank you.
Yeah, no, I'm excited to talk about this. And I know that you just, from what I see on social media, you know a lot about a lot of different things. And I wish we could talk about all that. But I know in a little bit, we're going to focus mainly on fluoride and some other stuff. But you are a biological hygienist. So for those who
Correct.
Don't know what that means, what is that?
I call myself a biological hygienist because what I am doing is I am looking for the root causes of dental disease. I am not just cleaning plaque off and telling patients to floss more. I'm looking for the systemic issues. What is going on nutritionally? How are they breathing? How are they sleeping? What their emotions are? How their gut health is? What foods they're eating? because that all plays a part in how healthy their immune system is. And until we get to the roots of dental disease, we are not going to cure dental disease. So as a biological hygienist, I'm looking at blood work, I'm looking at sleep, I'm looking at breathing, we talk nutrition. So it's a much deeper foray into their total body health. And that's where I think dental hygiene should be, is total body health. The mouth is connected to the body.
Yeah, I know. It's been like considered separate for just like way too long. It's dumb. So did you have to go to school or get a certification for this?
So I am a member of the International Academy of Oral Medicine and Toxicology, the IAOMT, and I have a biological accreditation from them. I took their course. And I'm also a member of the IABDM, which is the other biological group, the International Academy of Biological Dentistry and Medicine. And so that's where I get the bulk of my continuing education. Is looking at toxins and mercury and fluoride and diving deeper. And those programs allow me to do that. They have the continuing education that helps me focus there. And then I just read a lot. So it's not just, you don't get a biological degree.
Okay.
But it is just continuing education.
It's more a philosophy, right? And always
Correct.
looking for the root cause of that. So whenever people see biological hygienist or biological dentist or whatever, it's kind of meaning this holistic type of approach, right?
Correct.
Okay.
Correct.
So also I wanted to ask too, before we start talking about fluoride, in order for a hygienist to practice this way, I would imagine your office also has to have this philosophy, right? I would imagine a biological hygienist that goes into maybe a run-of-the-mill dental office might not be a good fit.
It probably won't be a good fit.
Okay.
Because the whole office needs to think this way. This has to be from the top down and the bottom up.
Yeah.
And you can't, I would love to say, yes, you, as a hygienist, you can practice like that, but you've got to have support. Because if the doctor comes in and says, oh, well, we need fluoride, and you just told the patient no fluoride, that won't work. So it is always better to work in a biologically oriented practice. But there are lots of biological dentists throughout the United States, and they are hungry for hygienists that think this way.
Oh.
They are. And the IAOMT has over 2,000 members, and they're always asking me for hygienists.
Well, I'll make sure.
And so my goal.
I'll make sure to link that. And I was going to ask you too, do you think that there are more and more clinicians seeking this type of education out and want to start practicing this way?
I wish I could say yes, but the problem is that nobody knows about this. I had no idea that this even existed as a subspecialty, if you will, until about 7 years ago when I fell into it. And it's like, this is what I've been looking for my whole clinical career, because I've used a microscope, a phase contrast microscope, since 1985. I have used Ozone for the last 15 years. I have done myofunctional therapy. So I had the airway, the microscope, and all of that. But I was still frustrated. Why aren't my patients healing? Because they still had spirochetes on the microscope slide. They still had bleeding. And so I was hungry for, what am I missing as a clinician? And when I fell into biological dentistry, I was like, here are the answers. It's the immune system. It's the nutrition. It's sugar. It's sleep. It's not having the building blocks for health. And that's what biological dentistry has given me, is all of the building blocks. And now I can guide my patients towards a healthier systemic whole body. And that's what we want, is we want a health span to equal our lifespan. And we don't want chronic disease. And the mouth is the barometer. It's the canary in the coal mine for how healthy the body is. So we can scrape teeth, we can clean teeth, and we can yell at our patients to floss more. But that's not the answer. It is the whole body and putting the mouth back on the body.
Yeah, no, I love that. And I'm hoping that we have some time, maybe towards the end, to talk a little bit about the microscope and ozone. But I do want to pick your brain about fluoride because this is such a hot topic right now.
It is.
What does the science say right now about fluoride toxicity? And I guess before we dive down this road, I just want to make clear, at least when I'm talking about fluoride today, I'm mainly talking about systemic fluoride, not topical fluoride. But what does the science say as far as like toxicity? And is there a certain level that people get to when it starts to become problematic?
So the fluoride in our water is the toxic waste byproduct of the aluminum and the fertilizer companies. So especially the fertilizer companies, the phosphate fertilizer companies. And that is what is in our water system.
So it's not the naturally occurring fluoride.
It is not naturally occurring fluoride at all. It is hexafluorosilic acid. And I probably didn't, I got too many silics in there. Hexafluorosilic acid. And that is the toxic waste from the wet scrubbers. So the fertilizer companies had to put a pollution control device on it because they were spewing fluoride toxins into the environment, and that was ruining the surrounding community in Central Florida. And so they put a pollution control device on top, and then they scrape out the smokestacks, and that is the fluoride that they then sell to the water companies that put the fluoride in the water. And it is a toxin. And like what just happened in Utah. Utah is no longer allowed to put fluoride in the water. Okay. So they now had all this toxic waste that they now had to pay to have removed.
Interesting. And Florida is following the same path, right?
Correct. So two states have outlawed fluoride in the water as of now. So yes, the fluoride in our water is a toxic waste byproduct. Now, what people say is that they are lowering it to a level that is safe, 0.7 parts per million. Okay, but the problem is, it's number one, sometimes the water flows more, sometimes the water flows less, that it is not an exact science. So sometimes we get a lot more fluoride in the water than others.
Yeah. Are there people monitoring that? That's what I've wondered too. Like, is someone actually watching this?
There are, but it's not an exact science. If you look at fluoride overflow into the water systems, there are a lot of times that they have documented that there's been too much fluoride in the water and it's caused problems. And I think I sent you the link to those fluoride toxic waste dumps. So I have sent you that. Now I can resend it again if you want it.
Yeah, no, I remember looking at that. It's just crazy. All of the stuff you sent me, I was just like, oh my God. Because like some of it I knew and some of it I had no idea. And I didn't learn until this year the fluoride in our water isn't naturally occurring fluoride that people kind of say that it is.
Yeah, it is not. And I would say 90% of the United States is fluoridated with the hexafluorosilic acid. So not everywhere, but probably 90%. I'm somewhere around
that. The vast majority.
The vast majority. Now, the thing with fluoride, it affects, yes, it makes the teeth hard, but the way it works, and Dr. John Featherstone documented this in a research study in 1999, and the CDC repeated this in their document in 2001, is that fluoride in the water works topically as we are drinking the water. It makes the teeth hard. Okay? But what it does, yes, it makes it hard, but it makes it brittle. And it only goes into the tooth surface 6 nanometers. When I was in hygiene school, way back in the dark ages, I thought that fluoride went all the way into the tooth structure, made the whole thing hard and resistant. That's the way I understood it. But when I went looking for the research that says, how far does fluoride go into the tooth structure? It's 6 nanometers. I couldn't find any other research except for this one study that said 6 nanometers. So yes, it makes it hard, but then it also makes it brittle. And we need to pay attention to the people who are affected by fluoride, because everybody's allergic to, everybody's different. So some people cannot excrete fluoride like other people. So we need to put the level at the lowest common denominator so that it doesn't affect the people who have kidney disease, who can't excrete fluoride. For the unborn, who have no teeth, they don't need fluoride. And for pregnant women, and for diabetics who, drink more water, for athletes who drink more water. So all of those people are accumulating more fluoride in their system. And fluoride affects not only the teeth, but it affects the heart, the joints, the bones, the brain, the thyroid, the pineal gland, you name it. Fluoride just I want to say destroys it. I mean, it really damages our bodies. And we're so fixated on reducing tooth decay, but that doesn't get to the root of it. That's only a Band-Aid. That does not, even topically, work like we are told it does.
Well,
and the latest Cochrane...
We need to fix the diet issue. Like fluoride is just a mitigation technique for poor diet. Yeah. I don't know. We really need to put more emphasis on that.
Exactly. We get so little training on nutrition. Yeah. And tooth decay is a nutritional deficiency. It is a vitamin deficiency. It is a lack of fat-soluble vitamins. It is sugar. This is key. Sugar stops the dental tubule flow. So not only does it feed the bacteria in the mouth, it stops that dental tubule flow. If you look at Steinman and Leonora's research, which I stumbled on way after dental hygiene school, it was a game stopper for me, because when you stop that dental tubule flow, now you get backwash down the dental tubules. And that's where the bacteria go right back in the tooth, and then that's where decay really takes its roots. So tooth decay, we've got to feed the odontoblasts. We've got to get that dental tubule. We've got to hydrate our patients. Those are the keys to preventing tooth decay.
So if someone's wanting to move away from fluoride, are there other techniques that have been shown to be effective for remineralizing teeth or preventing cavities? Like, I'm just thinking nano-hydroxyapatite for one.
Correct. Yes. I have products in my office that I put FIG, F-Y-G-G, Feed Your Good Guys, Dr. Mark Berhena's fluoride-free varnish. That's a 10% nanohydroxy. I also have Crystal Care remineralization strips. And these are also very natural. And I have the patients put them right on the teeth, and they melt right in. Just like they're like the old Listerine wafers.
I remember
that you used to put on your tongue. Yeah. Well, these Crystal Care remineralization strips go right on the teeth and stop the root sensitivity. It is amazing, and it remineralizes the teeth.
What's the active ingredient in that?
Nanohydroxyapatite. Yeah.
Okay.
Yeah. And that's all it is. It's just a nanohydroxy. So again, I'm looking for products that don't have a lot of chemicals in them, because I want the patients to be able to put them on, because toxicity is a major factor. And when I look at what's in toothpaste, especially commercial toothpaste, and having a warning label on there, do not swallow. That should concern everybody, because one of the biggest reasons that parents call poison control is because their child swallowed toothpaste. There are just thousands of calls a year to poison control because of toothpaste. And when we ingest too much toothpaste, that can cause, how many of us have given fluoride treatments and their patients have a stomachache afterwards?
Yeah.
I wasn't paying attention as a hygienist when I was doing fluoride treatments, and I know I did that a lot. And I know I've had a few patients that ran to the bathroom because when I took those foam trays out, they had sucked all the fluoride down, and now they are bolting to the bathroom to throw up. That should have given us pause, that we are putting something in a body that is toxic. Fluoride, when it goes into the gut, it changes the hydrochloric acid in the gut to hydrofluoric acid. And that destroys the gut lining. So if we're drinking a lot of fluoride every day, again, we're destroying that gut lining. And the research shows that. I'm not just pulling these things out of the air.
Yeah.
I have it all documented.
Well, what do you say, though,
when
to
we-
people? Because this is obviously all over social media now, but people who are maybe pro fluoride, they say, well, it's the dose that determines the risk or whatever it is. But you're saying for some people that it could even just be a little bit and that could make them sick.
Exactly. There is no dose control, especially with water. Okay. And so we have to adjust it to the lowest common denominator. And for those people, how do I pick who gets the big dose, who gets the little dose? I don't know. So that's, yes, the dose makes the poison, but we have to be better than this.
Yeah.
To put a toxic waste byproduct in somebody's mouth and say that it's safe, you may be allergic to fluoride. I may be allergic to fluoride. I mean, how many patients have hives? How many patients are sensitive to nickel? How many patients are sensitive to foods? Everybody's got something.
Yeah.
And I just, we have to elevate our profession and stop putting Band-Aids on.
Well, and I think too that you and I have talked about this before, but just because you were taught something in school, like that doesn't mean that you have to just adhere to that for like ever, because we're learning things change and science evolves, and like it's okay to change our mind. And I think some people are just they've got this death grip on what they were taught in school, and they're not comfortable veering from that.
And that is so true. And we should be lifelong learners. What we learned in school, within 45 years, 50% of it is either incorrect or obsolete. And I have been a hygienist for 45 years. So, half of everything that I learned is wrong.
Yeah.
And so my goal every year is to get 100 hours of CE. I want to be the best hygienist I can be. And what I learned today may not be correct tomorrow. And then I'm going to change.
Yeah.
And there's so many things that we learned now, I just don't do anymore.
Yeah.
So it's up to us to, as a profession, elevate ourselves and continue learning all the time.
Yeah. I remember back in school, it was back when did I graduate? 2008. And we were taught then to not treat pregnant women, like, period. And I mean, we don't recommend that anymore, So that's just one thing I can think of that's changed.
Yeah.
I wanted to ask you about fluoride and how it affects kids differently than adults. And also if you can talk to us about skeletal fluorosis, because I know that that's a thing, but I never even considered the long-term ramifications of skeletal fluorosis until now.
Okay. Infants are getting adult doses of fluoride in their formula. Adult dose. And adult dose in a child accumulates in the bones. It affects the brain, it affects the joints, it affects the bones. So when you see in children, you see fluorosis, even the little white streaks, that is an outward sign of inward fluoride toxicity. And it accumulates in those tissues, and it calcifies. It calcifies in the bones, it calcifies in the teeth, and it calcifies the pineal gland. Those are the main places, and even kidney stones. So how do we control the dose? In water. We can't, because some kids drink more water than others. There is a higher incidence of fluorosis in the Black community. There's a lot more lactose intolerance in the African American community. And so they're drinking more water. And so the fluorosis, it's documented in the research, the fluorosis is more, and it's more severe. And when you don't have access to good, healthy fruits and vegetables, we don't get enough antioxidants. So again, that locks the fluoride in the body, and it accumulates slow and over a whole lifetime. And so small incremental doses of fluoride show up in adults. as you said, skeletal fluorosis. Skeletal fluorosis mimics arthritis. So the joint stiffness and the bone deformation. Now, in areas like in China and in India, they have a lot more natural fluoride in their water, and they have a lot of bone deformities. They have a lot of skeletal fluorosis in those regions, and it's irreversible at that point. So even natural fluoride is not healthy. There's nothing in the body. There's no fluoride deficiency. There's nothing in the body that needs fluoride.
Okay.
And there's not, if you don't have fluoride, you will live just fine. And so to be beholden to fluoride and to use it and to want it in our water when it is so destructive, when it's a Band-Aid, it doesn't work.
Well, and with skeletal fluorosis too, so I'm at the age now entering menopause that I'm very concerned about my muscle and my bone density. And I know I've read the statistics on like women fracturing bones as they're getting older and how that just leads to all these issues. And I'm like, could fluorosis be playing a part in this too? Because fractures are like super common in women as they get older.
Yes. So it makes the bones hard, but it makes the bones brittle. And so there is research that connects fluorosis to more hip fractures.
That's crazy.
Yes. Yes.
And then with kids too, not necessarily babies or maybe babies, I don't know, but just children, do they process fluoride differently than adults? It just occurred to me. I was like, wait, are they even able to process this?
Well, so one of the things that the research does show is that when young boys at 6, 7, and 8 years old are exposed to fluoride, it affects the bone, and then there is a higher incidence of osteosarcoma in their 18, 19, 20-year-old boys. And there's a connection between that and the bone cancers in young boys.
Oh, wow. That's
young
scary.
men. Yeah.
So how do you respond? I'm sure this drives you crazy every time you open up your phone and check social media, but how do you respond to people who say that like fluoride doesn't pose any risk because it's natural and it's naturally occurring and it's fine for us? And that these studies that quote unquote show like fluoride toxicity are at levels way higher than what we would see in like the water system in the US.
Yes, it drives me crazy.
Yeah.
Because, like I said in the beginning, there are times when we get a lot more fluoride in our water. But we can't just look at the fluoride in our water as part of the whole entire fluoride we are exposed to. Food that we eat that's processed with fluoridated water, fruit that is grown with fluoridated water, drinks that are bottled from fluoridated water, and even like tea. So many people drink a lot of tea. The darker the tea, the more fluoride there is in naturally occurring fluoride. Plus, things that are watered and then dried, you again have more, like raisins, have a higher level of fluoride. So you've got to look at the whole picture of fluoride exposure. And then, who is sensitive to what again? That's it all. We have to look at the whole accumulation of fluoride. And where the body it's not a natural part of what we have, so the body has no mechanism for dispensing it, really. And fluoride, it binds with calcium, it binds with magnesium, it destroys enzymes. So and even iodine. We have a higher incidence of thyroid issues, and fluoride displaces iodine in the thyroid.
See, and
how many of our patients?
I've had patients tell me that over the years. They're like, well, I have a thyroid issue. I'm not going to do fluoride. And honestly, I'm embarrassed to admit this, but I thought that they were like kooky. I'm just like, oh, they're just one of those, like whatever. But I mean, I'm kind of seeing a lot of patterns now, and I'm like, okay, I think that there is actually something to this.
Yes, there is. There is. And so many of our patients are on thyroid medicine.
Yeah.
And thyroid iodine is right there in the periodic table with bromide and fluorine, and so it takes the place of iodine in the thyroids. And then because it binds magnesium, it makes our magnesium inert. And magnesium is needed for over 300 functions in the body. And then it calcifies the pineal gland, so we're not making melatonin. So we're not sleeping.
Jeez.
I mean, the Cochrane report that came out in the fall said that fluoride, topical fluoride, and also systemic fluoride really has a negligible effect on tooth decay. And that should, I mean, the Cochrane report does good research. And so we're holding on to fluoride like it's the last great hope. But the research says again and again that it is a toxic waste. It destroys brain cells. It destroys the iodine in the thyroid. It does so many destructive things. Even for me, even if it stopped tooth decay 100%, I couldn't support it because of how destructive it is throughout the whole body. Yeah. And it only, according to the Cochrane report, it maybe will stop a half of a cavity on a tooth. Let's do better. Let's elevate our profession so that we get to become the real healers that we should be. And that means that we have to elevate our whole profession by looking at what's going on in the gut, what's going on in nutrition-wise. We can't just scrape teeth, flap fluoride on there and say, see you in 6 months.
Yeah.
We have to spend more time as a profession with our patients and really get to the root of the problems.
So what advice do you have for someone who is trying to figure this out, like reading articles? And we've got articles saying that fluoride is perfectly safe and just as many that say that it's bad. Like, how are people supposed to know what's right?
Well, I mean, even for me, I know it's a toxic waste byproduct. So why would I put something that has a poison control-ish sticker on it in anybody's mouth? Yeah. That's my line in the sand. Everything that I put in the mouth, I have to be able to swallow it. So if I can't swallow it, if it's not safe for the gut, I'm not putting it in the mouth. Okay. So that includes fluoride, that includes mercury, that includes nickel, that includes the adhesive in fluoride varnish. That's not a safe thing to swallow either. And then, there are lots of items in toothpaste with propylene glycol. That shouldn't be swallowed either. So if I'm not going to eat it, I'm not going to put it in the mouth. That's my line in the sand. And then, what can we do? We have to look again at the root causes. And that's where I spend my time.
Yeah, it's just, I feel for people. I mean, honestly, it's confusing for me as a dental clinician, and I know a thing or two, and I'm just like, what about the general population who's seeing all these mixed messages, and then they go into the dental office and they're like, I don't know, like, is this okay for me? Like, I feel bad for them.
Yeah. For me, once I started reading The Dental Diet and Weston Price and the Weston Price Foundation, because I'm looking at food and nutrition, and even The Dental Diet is an excellent beginner book for the public. I give my patients homework. I say, here, you have to read this book, then let's talk. Because I don't have, I luckily have 90 minutes a patient. I see 5 patients a day. My body is so much healthier, and I have the time to spend and educate my patients. And I feel fortunate.
I think you are.
Okay.
You're very fortunate.
I know. But that's the way we should be doing hygiene.
I agree.
Not busting out patients every 45 minutes because we can't educate. We can't do an oral cancer screening. We can't do a full perio charting. We can't sit and talk with our patients and educate. And that's what we are, is we are prevention specialists. Yeah. We are educators, first and foremost. There's nothing magic that I do that my patients can't do at home. But they have to have the tools. They have to have the time. I have to put a toothbrush in their hand. I have to have Pixters and Waterpik and the right paste and the right products and educate them. And that takes time. And I know it's expensive. But in the long run, if I keep them from getting one crown, one cavity, I have paid for myself 100 times over. Yeah. When we do full mouth reconstruction, it's $50,000 to $75,000. That's what it costs. So let's spend that time now educating the patients. And yes, it's an extra fee, but in the long run, their body's healthier. They don't have a heart attack. They don't have a stroke. They don't have dementia. Dementia, oh my gosh, is going to triple by 2050. That's only 25 years from now.
It's so scary.
And we are setting them up for that if we don't address the spirochetes and the porphyromonas gingivalis and the parasites that are in the mouth. And that's why I use a microscope. And that's why I spend the time to educate my patients. So I give them homework. I say, I want you to read the dental diet. I want you to read my blog articles. I want you to listen to my doctor's podcasts. She does a podcast called Your Mouth Matters. There's so much good information on there. It is time for the population to educate themselves as well.
Yeah, with like actual science, not just like crap they see on TikTok, right?
Yeah, exactly.
Yeah.
Exactly.
So that's actually a great segue because I do want to chat with you about the microscope. You said you've been using that since the 80s. And how
85.
how does that work during an appointment? And what have you seen as far as like the benefits of it with patients?
So I use the microscope on every single patient. It is part of the first thing I do as I do my oral cancer screening. Then I take a plaque sample and I make a plaque slide and I put it off to the side. And then I do disclosing. I use an air polisher. I have ozone in my air polisher, so I am disinfecting, so I'm not causing bacteremias. And then at the end, we look at the microscope slide. And then I'm looking at variety, quantity, and motility. I'm looking at spirochetes. I'm looking at, is the slide healthy or not? I'm looking at who's at the party. Is it wild and crazy? Is it a nice, quiet, healthy slide? And then that, I've already shown the patient, oh, your gums are bleeding. Here's a mirror. Here's where you're leaving plaque. I use a tricolor disclosing solution. So we see new plaque, old plaque, and acidic plaque. So they already know how healthy their mouth is. And then the microscope slide confirms it. And then when they see those spirochetes worming over and like snakes and parasites, the amoebas oozing across the screen, then they're sold. They are like, what do I need to do? What do I need to do right now? And I want my family to see you, and I want my husband to see you. And what do I need to do right now? They are on board. I don't have to beg. I don't have to say, you have gum disease. It's like they know it.
Yeah.
Because they can see the parasites. They can see the spirochetes. And, right by the microscope, I have a research study that talks about spirochetes and dementia, spirochetes and heart disease, spirochetes and arthritis. They have found spirochetes in the joints, in the synovial fluid in the joints.
Wow.
And the toxic waste byproducts that those spirochetes and porphyromonas gingivalis give off inflame the brain, inflame the joints, inflame the body. We see it in the mouth, the inflammation they cause. Do you think they don't affect that in the rest of the body?
Yeah.
And if we put our instruments in a pocket, we introduce these pathogens into the bloodstream. Every time. So before I put my scalers in there, I am disinfecting with ozone.
So
ozone gas.
What is that? Is that like a liquid that you put into to your polisher? Like, how does that work?
So ozone gas kills bacteria, fungi, parasites, viruses instantly. Ozone is oxygen ozone. It is between 0.2% and 5% ozone, and the rest is oxygen. And these are anaerobes. And so I have an ozone machine right by my chair. I have a big ozone water maker. And so I have ozone water in my unit, in my air polisher, and in everything that I do, I use ozone. And it's actually oxygen ozone, but it's ozone. Okay. And so ozone gas, I'll insufflate the pockets. I have a 24-gauge side port cannula that hooks up to my ozonator, and I put that right into the pocket. Ozone gas goes into the tissue and into the tooth tubules, 3 to 5 millimeters. So I am killing everything instantly. And then in my air polisher, I have ozonated water. So we make ozonated water every morning. I have fresh water. And so when I put my air polisher in, again, I am disinfecting. And then if I'm doing any kind of therapy, I will go back in at the end. Well, and my piezo also has ozonated water. And then at the end, I will go back in and disinfect yet again, so that I am leaving that patient with a healthier microbiome, because the ozone kills the anaerobes. And then I'm talking probiotics, and I'm talking prebiotics, and I'm talking gut health as I'm working, so that I am setting them up for a healthier microbiome.
So with this ozone, would that replace things like irrigation with antimicrobials or like laser treatment?
Yeah. Well, yes.
Okay.
I mean, for me, it does, because the laser doesn't kill all of the bacteria. It's bacterial reduction, but it doesn't kill all of them. And ozone does.
Well, in the laser, I mean, I'm not a pro on laser, but you said ozone penetrates like how much into the tubules? I haven't heard that about lasers.
3 to 5 millimeters.
Okay.
Yeah. And it's a gas, so it spreads out. Whereas a laser beam is a laser beam. And so I'm disinfecting both the tissue and the tooth tubules. And our decay bacteria are deep into those tubules.
Yeah.
They're actually all the way into the pulp chamber.
Wow.
Yeah. So how do we can't scrape our way out of it. We have to have better tools. We have to be smarter. And these bacteria and viruses and fungus, it's everywhere in the mouth. So I'm cleaning the tongue, I'm cleaning the tissues, I am irrigating, I'm putting ozonated water in those pockets with my piezo, I am putting ozone gas in those pockets with my 24 gauge side port cannulas. So my patients are finally healthier.
Do you see it too? Like if you have a new patient maybe that comes in and you look on the microscope and they've got all those like bad bugs swimming around like crazy, and then you educate them, maybe treat them. And do you see improvement as they're coming in? And
Absolutely.
I would imagine that's huge for patient engagement.
It is. I have the patients videotape their slides.
Oh, cool.
And then, and so then when they come back, they're like, oh my gosh, that is so much better. And they get to see it clinically, because again, I'm disclosing and I'm giving in the mirror, and we sit and talk for a few minutes about how healthy their mouth is. And they see that there's less bleeding, and then they see the microscope slide, and it's so rewarding. I love my job. I'm not ready to retire because I am motivated. I am passionate about oral and systemic health. And I've been a hygienist for 45 years, and I still love my job.
Well, it's because you're able to practice the way you want to, right? Which makes me scared right now with everything that's going on, that hygiene is just being pretty much reduced to scraping teeth. And it's just like, we're so much more than that,
We are. But until I knew about biological hygiene, until I knew about that, I was just a tooth scraper with 8 patients a day, busting them in, busting them out, doing my best to motivate them. And then they would look at the slide, they'd see the spirochetes. This was before I became a biological hygienist. And then the patients would say, well, yeah, I see the spirochetes, but, my insurance doesn't cover it, so I'll see you in 6 months. And it's like, but you have an infection. Yeah, but my insurance doesn't cover it, so I'm not coming in. And we have done this to ourselves as a profession. We have allowed the patients to say what treatment they want. Cardiologist wouldn't allow that. Your doctor doesn't allow that. Why does dentistry allow that? Patients think they can't afford it because their insurance doesn't cover it. Well, it's up to us to educate them.
Yeah, no, I agree. I think insurance companies, I have my own rant about that, but dental clinicians too, we have allowed this to happen for way too long. And now we have to unravel all of this stuff.
Yeah. And so that's why I put slides on LinkedIn. People can go to my LinkedIn page, see those microscope slides, see the different bacteria. Everybody's different, and But, 90% of our patient pool has some level of dental disease. So, whether it's tooth decay or whether it's gum disease, and then we throw our hands up and say we can't cure it. Well, we can't cure it until we get to the root of the problem.
Yeah.
And so that's where dental hygiene, I'm excited for dental hygiene. This is like a grand reawakening for us as a profession. And to embrace biological hygiene. I invite all of you to come and become members of the IAOMT and learn about this and get a chairside microscope and do salivary testing and do, blood work and learn more because until we look at the blood work, we're not real clinicians. We're not healers.
Yeah.
We're just tooth scrapers.
So that's what I was going to ask you. Like, if I'm sure people are listening and they're like, okay, I want to learn more about this or start practicing this way.
Yeah.
Like, is there somewhere that they can go to at least start?
Absolutely. The IAOMT, so the International Academy of Oral Medicine and Toxicology, has a biological accreditation program. And then the IABDM, our sister organization, also has a biological accreditation program. Okay. It's a 10-unit or 15-unit course. Sit down and start there. And then come to meetings. And then we meet twice a year. And our next meeting is in September in Greenville, South Carolina. So we meet on the East Coast, we meet on the West Coast. And I haven't missed a meeting since 2021. I go to every meeting. I also, I'm a member of the IABDM. I go to their meetings as well. It's up to us to educate ourselves. How do we harness the healing energies in the body?
Yeah. And we're not taught that in hygiene school or dental school. Is there a list somewhere of offices that practice this way?
There are. Absolutely. Okay. On the IABDM and the IAOMT website, you can go find a dentist. And you'll see a list of dentists there in every state and throughout the world. We just had a meeting in Istanbul, and we had 75 doctors and dentists come to that meeting. So it is international. And I would love to see every dental office have a microscope and practice this way and change the way we heal, because we're always going to have bacteria. But we need to have good bacteria. We need to have good viruses. We can't be afraid of these things. Yeah. We have to change that microbiome. And until we heal the gut, because it's all actually in what's happening in the gut, it dictates what happens here. This is just a symptom of greater oral dysbiosis, body dysbiosis.
Yeah, and that's a link too that I don't think have done a great job on, is the mouth and the gut connection. But it's huge. It's like everything.
It is everything. Yeah. And so in my office, we are now doing a gut restore protocol. So anybody that has periodontal disease, anybody that has tooth decay, gets a gut restore protocol. That is part of our healing program. And it is 3 months of gut changing and then 3 months of gut restore. And then I'm also doing perio protect trays because I want to change the microbiome in the mouth and jumpstart the healing in the mouth.
And you've seen good results with both of those?
I have seen excellent. Yeah. Yes. So changing it up so that we're not saying the same thing every time, because the patients just tune us out. It's like flossing. Flossing is really hard to do properly. And I've got really enthusiastic patients, and I'm seeing a lot of floss cuts. I'm seeing floss trauma because they are working so hard to get that plaque off, and instead they're causing more problems. Yeah. So I want to give them tools that are easy, one step, one shop, boom. Let's give them things that work in their hands and not make it harder.
And not shame them.
They don't have.
Yeah,
exactly. Floss doesn't work. So, let's find something else. We've been talking floss for 50 years. And how many patients really floss properly?
I know. And it's like, it's been around for forever. And we still have these crazy high rates of decay and gum disease. Like something's not working. Yeah,
because floss doesn't go to the root of the problem.
Yeah, right. So, yeah. Well, before we close out, do you lecture on this, or do you put on courses or anything like that?
Well, as a matter of fact, Stephanie, we do. Thank you for asking. In October in New Jersey, Fran Horning, Catherine Gilliam, and I are hosting a course called Perio Boost. And BOOST stands for Biological Options for Oral Systemic Therapies. So we will talk about root causes. We will talk about biological hygiene. And we will talk a lot about the microscope and how to use it effectively chairside. So it's a 2-day course, October 24th and 25th. And I will send you the link to that.
Okay.
And then join us at the IAOMT. Our next meeting is the beginning of September. We meet in September and in March every year.
Okay.
So there's plenty of options for training. And I would welcome the whole hygiene community, because if we keep doing the same thing, we're going to get the same results.
Right.
And so it's up to us to really dive in. And I haven't found anything better than biological hygiene. I mean, this has been a grand awakening for me in the last 7 years. To put airway, to put nutrition, to put the microscope, to put gut health and systemic health all in one place. Now my patients are healthy.
Yeah.
And that's what I want. I went into hygiene to be a healer.
Right.
So how do we heal unless we dig deeper? And to be a real healer, you have to look. You have to look and dive in and get out of your own way and get rid of the things that you learned in school and be open to learning more and better and different and growing every day. Every day I'd say to myself, wow, why didn't I know that?
Yeah.
Where's this been all my life? And it's invigorating, and it makes hygiene just so much fun.
Well, I can like feel your passion through the computer about this. And I just imagine like there's so many of us in hygiene, well, in dentistry, that are burnt out. We're tired. We feel just like robots, and so maybe learning something like this could just break someone out of burnout.
Oh, it's rewarding.
Yeah.
I mean, that's why we're in healthcare.
Yeah.
So to have better tools makes all the difference, and to grow in our profession instead of doing prophy.
It's like, kill me.
Yeah. Yeah, exactly.
Yeah.
So, and I always welcome hygienists if they want to come and job shadow me. I'll come see what I do and spend the day with me.
So how could they connect with you? Like, what's the best place?
My blog is queenofdentalhygiene.net.
Okay.
And my email address is on my blog.
Okay.
So read my blog and come message me. I'm happy to Zoom. I'm happy to educate. They're welcome to our course in October. If you can't wait till then, message me, reach out to me. It's, let's change dental hygiene from the cleaning lady and the oral janitor to a real healer. This is our moment. This is where we shine. But we've got to have the tools to do it. And the courage. I know it takes a lot of courage to say, no, I'm not going to do 45-minute prophies. That's not a healer. That's just a tooth scraper.
Right.
And how much real scraping are we really going to do in 45 minutes?
I know.
It's not about the calculus. It is about the microbiome. And until we address the dysbiosis in the microbiome, we can put all the fluoride on there we want, the chlorhexidine, the iodine, all of that stuff. And we may see a little bit of improvement, but it's coming back.
Yeah.
Because we haven't dealt with the real root causes.
Yeah, I agree. Well, I'm going to put all the links down in the show notes so that people can connect with you. Good. And I just thank you so much for your time and all of your knowledge that you shared with us today.
Oh, my pleasure. My pleasure. I hope this just sparks some curiosity. Let's all be curious. What else can we do as a profession? It's an exciting time to be a biological dental hygienist.
Yeah, so I love your. So I've just been kind of in a funk lately about just the situation that's going on in dentistry. And I love your reframe that this is an exciting time, and it's a time for us to kind of really think what does being a hygienist mean, and what could that mean for us? And there's a different way to practice, you know?
Absolutely.
Yeah.
And it is so rewarding. It really is. We have the best job of all the healthcare professions. I mean, who else gets to spend, I spend an hour and a half with my patients. I see my patients every 3 or 4 months, and they're motivated as well. And so their motivation inspires me. And that allows me to be a real healer. And, training your patients is part of it. And so it is a reframe, and it can be done. I see it every day.
Yeah. Yeah, no, that's great. I know that people are going to get some encouragement from that. But thank you so much, Barbara, for your time today. Hopefully we get to talk again soon.
Absolutely. Anytime, Stephanie. It is my pleasure. So thank you for this opportunity.
Of course.
And I'm excited for our profession.
Me too. So. Me too. I need to snap out of my little funk that I'm in right now. And thank you, everyone, for listening. We will see you next time.